Good morning, everyone. It's a pleasure to be here. So I'm going to talk about reproducible personalized health research in a privacy-conscious collaborative environment. And this is a joint talk between Olivier Verscheur, who is heading the Swiss Data Science Center, and myself. So we have jointly prepared the slides. So the vision is actually pretty much compliant with what the previous speaker, Thorsten, has presented. So the purpose here is to build up a one-stop shop for collaborative research on health data in the context of the SPHN. So in this framework, the purpose is to allow a researcher to be able to generate and to queries that are going to leverage on the available data across multiple institutions. And this indeed provides a level of scalability that is unparalleled, but at the same time raises issues on the front of interoperability. So one of the crucial purposes here is reproducibility of research. And this is a really crucial dimension in the sense that much of science, and especially life science, has been plagued by the fact that more often than not, results have been published that were actually dubious or questionable just because they could not be reproduced. Right? And so one of the main purposes of this endeavor here is to make sure that research will be, once published, can indeed be reproduced by other researchers. So what I'm going to talk about is the response to the privacy threats in personalized health. It is something that I guess most of you have seen multiple times. The fact that more and more the health data and medical data are under attack, and the organized crime, unfortunately, has understood the value of these data. And so this has been documented quite extensively. And there are also concerns within the scientific community about the fact that it is possible to reverse engineer anonymization efforts that have been made, especially in the case of genomic data. So based on many discussions we have had in the framework of the SPHN launching phase, we have identified a certain number of requirements for this to be successful. The first is to have a pragmatic approach and a gradual introduction of user protection protocols, because, of course, the goal is not to disrupt ongoing medical research and clinical practice. Identification of the different sensitivity levels of the data, different access rights is also something that Effie has referred to. Exploit existing data, be future-proof, considering the long-term, value of and relevance of the data, and then take into account patient consent. And also, something that is sometimes forgotten is to secure the collection of the health data more and more via smartphones, wearable sensors, and so on. So for this purpose, we have proposed a project that is called DPPH, Data Protection in Personalized Health, that brings together the workforce and know-how of 5 research groups across the ETH domain, plus the Swiss Data Science Center. So you see here the smiling faces of the 6 PIs involved in this project. So this project is generously funded by the PHRT with 3 million, and it's going to start in a few days. And the goals are to address the main privacy, security, scalability, and ethical challenges of data sharing for enabling effective P4 medicine, and then to define an optimal balance between usability, scalability, and data protection, and we know how tricky this can be, and of course deploy an appropriate set of computing tools. And in order to prepare this, the launch and the start of this project, we have set up a workshop that took place at EPFL on the 15th of February called the DPPH 18 that brought together approximately 100 researchers of the biomedical field, but also of computer science, ethics, and legislation. Well, so this is how it looks like in practice. The one-stop shop for data science will leverage on the presence of blockchain. So this blockchain is a software construct that is going to be distributed across the different institutions, and that guarantees immutability of the data, especially immutability of the logs, and takes care of access control, and will also be very helpful for the provenance and reproducibility. As you know, a blockchain is a very trendy technique that actually it fits, and there is some hype associated with those techniques, but in this specific case, it's the appropriate tool, because the purpose here is to build trust in a way that is based on the collective contributions of multiple decentralized institutions. So let's go through a short animation. So the case is here a cohort exploration and research analysis. The first stage, the researcher inputs clinical and genomic selection criteria. Then then there would be a further query, which is not far from actually Thorsten had a more, let's say, inspired animation with the thing, but the principle is the same. It's a different way of showing things. The further query goes around, and there is a local secure and private query process that takes place, and this leads to bringing back a privacy-conscious result to the researcher. Based on this result, the researcher is going to send a request access to execute the protocol on the identified cohort, and then this will, there's going to be an approval. There is still human intervention, of course, to approve let's say, by the ethical boards or by the IRBs, in order to grant federated access. And all this is stored on the blockchain, and then the approval hopefully is granted, and then comes the secure and private distributed execution of the analysis with the reproducible logs, and finally the result visualization by the researcher. Voilà, so this is how it works, and we are currently developing and refining the tools that will enable this way of operating. Let me conclude. So, as there is no doubt nowadays that worldwide the confidentiality of health data is in jeopardy, and as mentioned also by other speakers, personalized medicine dramatically scales up the amount of data involving, of course, also all the omics data. And we also need to take into account the wearable collecting. And so we have a specific work package in DPPH that is focusing on that topic. So, as we've seen, what is needed is a federated and distributed architecture to implement data science in such medical environments. And so the goal is to bridge the gap between domain experts and to provide reproducible data science in order to guarantee the success of personalized health and to fortify trust in the whole system. So the DPPH in the framework of the PHRT program is actually a response, is a pivotal response to the concerns, and is based on the SDSC Ranga platform to guarantee, let's say, the appropriate scalability of the whole solution. And so, of course, the collaboration with SPHN and the PHRT DARE projects is crucial, and we already started to talk with some of them. Thanks for your attention.